Well, according to a new study by the CDC, the COVID pandemic has had a serious impact on the mental health of adolescent girls. ER visits, emergency room visits related to eating disorders and other mental health related issues doubled among teenage girls during the pandemic. Joining us this morning to talk more about the problem is Dr. Anna Brown, Clinical Director of the Eating Recovery Center in the Woodlands. Doctor, good morning. Thanks for being with us.
Good morning. Thank you for having me.
So I guess right off the bat, do you have any clue as to why the pandemic caused this increase in eating disorders?
Yeah, researchers believe that this increase was brought about by pandemic-related stress, a lack of structure and daily routine, and changes in food availability. And eating disorders really thrive in isolation and secrecy. So as you can imagine, the pandemic really had a negative effect on many people struggling with eating issues. And during the pandemic, I think people were also reluctant to seek treatment for fear of getting sick if they went to a hospital or into a treatment center. And so with more time on screens and less in-person connections and interactions, I think it was a perfect storm for vulnerable kids.
No kidding. Okay, so as we go forward, are things changing now? Do we see the trends moving in a different direction?
Yes, well, we've seen a great increase in folks reaching out for support. So I think that's the biggest, most positive change that we've seen, is that this has really brought to the forefront how much of a need there is for mental health care, and especially for folks struggling with eating concerns.
So for parents who may think their child has some kind of an eating issue, what is the first thing we should do? I mean, do we talk to the child? Do we go right to the professional? What do you think?
Yeah, parents really should trust their intuition on this and take action. An eating disorder is really a serious mental illness that requires specialized care, but it's important to note that eating disorders are treatable. And the earlier we can treat an eating disorder and intervene, the better the outcome for a lasting recovery. So as a parent, making yourself available to talk to your kids if you're noticing changes in their patterns or their behaviors, their personality, and then don't wait for your kids to come to you. Seek out support right away.
Where do these eating disorders come from initially? I mean, you mentioned mental illness or mental health. Is it body image? Is it a relationship with food that's unhealthy? I mean, where do these start?
Yeah, it really is a perfect storm, like I mentioned. It's always a combination of factors. It's really never just one in particular thing, but we see vulnerabilities in folks' temperaments, things that make them, more vulnerable to things like perfectionism or the way they view themselves in the context of the world around them. Social influences, things, like media, the influence on our body image can have a big impact. And then we know that biological factors are a big component also, just how our brains are wired, how we think about things, and our genetics.
Hey, doctor, what kind of programs and support do you guys offer at the Eating Recovery Center?
Yes, at Eating Recovery Center, we offer partial hospital, which is a day treatment program, and intensive outpatient programming to adults and children and adolescents.
Okay. Well, one of the things, and maybe this is a common misconception still, that eating disorders only affect women, but we know men can be susceptible to anybody. I guess, are there any limitations by either gender or age?
No, I mean, really, eating disorders do not discriminate. It really is a misconception that males cannot have anorexia, bulimia, binge eating disorder. And unfortunately, these are diagnoses that really go routinely overlooked when according to males. And we see actually a higher occurrence of eating disorders in male children than we do in females. And again, during puberty, when males' bodies are changing in their height and in their weight at a really rapid pace.
Are there things as parents that we can do to, like, maybe definitely make things worse? Like are there things we should avoid, like maybe not talking about weight so much, or trying to make sure we encourage a better, healthy body image in our children? But both sides of that, what can we do and maybe what shouldn't we do?
Yeah, it's really important that if parents are concerned about an eating issue with their child, that they seek professional insight and support as early on as possible, really to get as educated as they can about kind of the do's and don'ts, or what's helpful and what might be hurtful. And then really committing themselves to remaining involved throughout that process. The recovery process can be lengthy, and it can be a stressful time trying to make those changes and get those issues addressed. So we encourage parents to stay involved, become informed, join support groups, get educated.
Gotcha. And where can our audience go for more information about the topic and specifically what you folks do?
Absolutely. Eatingrecoverycenter.com is an excellent resource for education about eating disorders, also about our approach to eating disorder treatment and recovery. There's also resources, support groups, and educational materials there.
Dr. Anna Brown, Clinical Director of the Eating Recovery Center in the Woodlands. Doctor, thanks so much for your time as a parent of two teenagers. I really appreciate it so much.
My pleasure. Thank you.